Hello, this is the Timbuktu Lab channel where we provide information and analysis of global topics and phenomena from a scholarly perspective. In the year 2020, there is the emergence of the COVID-19 or coronavirus pandemic, which originates in China in December 2019 and became known to the world in January 2020. By November 6, 2020, the disease had infected 49.65 million people in the world, including in Africa. It had also resulted in the deaths of 1.25 million people by November 6, 2020. Although Africa has been negatively impacted by COVID-19, the spread of the disease and the death rates have not been as high in African nations as they are in Asia, Europe, Latin America, and North America. For example, by November 6, 2020, while there were 14.2 million, or 28.7% of the world's total people infected in Asia, 11.96 million, or 24% of total people infected in North America, 11.6 million, or 23.4% of the world's total people infected in Europe, 9.9 million, or 20% of the world's total people infected in South America, the figure was only 1.8 million, or 3.76% of the world's total people infected in Africa. Let us now go over the top 7 factors responsible for the relatively low COVID-19 cases and deaths in Africa. Number 1. Low volumes of international tourists to most African nations. The COVID-19 or coronavirus pandemic is widely reported to have originated from the city of Wuhan, the capital of Hubei province, central China, in late December 2019, and to have spread to Europe and North America by early January 2020. A careful observation of the countries with the highest infection and death rates shows that they have very large volumes of international tourists that they host annually. For example, according to the World Bank, as of 2018, there were 519.57 million tourists that visited European Union countries, 320.27 million tourists visited East Asian and Pacific nations, 113.35 million tourists visited Latin American and the Caribbean nations, 101.46 million tourists visited countries in the Arab world, and 101.16 million tourists visited North America. In 2017, there were only 47.63 million tourists that visited sub-Saharan African nations. Since the coronavirus is spread by people who traveled across the world, this low rate of tourist visits to Africa appeared to have been good for the region. Interestingly, the African countries with relatively high tourist visits have the highest COVID-19 cases in Africa on November 6, 2020. 734.2 thousand cases and 19.7 thousand deaths in South Africa, 246.3 thousand cases and 4,127 deaths in Morocco, and 108.75 cases and 6,343 deaths in Egypt. These three countries have 1.09 million, or 58.4% of Africa's COVID-19 cases, and 30,219, or 67.3% of deaths on November 6, 2020. In 2018, 12.29 million tourists visited Morocco, 11.2 million tourists visited Egypt, and 10.47 million tourists visited South Africa. Age appears to be playing a significant role in the infection and death rates of the COVID-19 pandemic. It has been widely reported in the media across the world and in scholarly journal publications that, regardless of geographic location or racial or ethnic backgrounds, COVID-19 tends to impact the elderly more than young people. This observation could help to explain the relatively low rates of COVID-19 infections and deaths in Africa compared with other world regions. This is because in Africa, as of July 2020, of the 1.34 billion people, 533.5 million, or 39.8%, are under the age of 15, and 18.1% are aged 15 to 24. These same rates are 15.05% and 10.39% respectively for the European Union, 18.6% and 12.91% respectively for the United States, 25.33% and 15.42% respectively for the world, and 17.29% and 11.48% respectively for China. In fact, as noted in our last video, the youngest people in the world are in the West African nation of Niger, with 50.58% of its 22.8 million population under the age of 15. It is useful to note that the proportion of people under the age of 15 is relatively lower, and also the proportion of those aged 65 and over is relatively higher in northern African nations and South Africa compared with other countries in sub-Saharan Africa. Algeria with 29.58% and 6.17% respectively, Egypt with 33.62% and 4.44% respectively, Libya with 33.65% and 4.04% respectively, Morocco with 27.04% and 7.11% respectively, Tunisia with 25.28% and 8.86% respectively, and South Africa with 27.94% and 6.09% respectively. These visible differences could be a potential factor for more COVID-19 cases in North African countries and South Africa compared with their counterparts in sub-Saharan Africa. Africa's youth, which has sometimes been viewed as a liability, is currently what has contributed to lowering the cases of COVID-19. Number 3, low obesity rates in Africa. It has been widely reported that obese individuals are at a disadvantage when fighting the COVID-19 disease, primarily due to a number of underlying conditions resulting from being obese. In 2016, the adult obesity prevalence rate in the United States was 36.2%, Canada 29.4%, United Kingdom 27.8%, Spain 23.8%, Russia 23.1%, Germany 22.3%, Belgium 22.1%, France 21.6%, and Italy 19.9%. In Africa, the obesity adult prevalence rates are very low for most of the countries, especially in sub-Saharan Africa. However, the figures are relatively higher in countries in Northern Africa and Southern Africa, especially South Africa, which could be a potential factor for their relatively high COVID-19 cases. For example, in 2016, there were 28 out of 54 African nations, or approximately 51.9%, with obesity proportions of 4.5% to 8.9%, and 12 nations, or about 22.2%, with obesity proportions of 9% to 12.7%. In our first two videos, we presented the 10 countries in Africa with the lowest obesity percentages and the 10 countries in Africa with the highest obesity percentages. For example, the countries in Africa with the 10 lowest obesity percentages as of 2016 are Ethiopia at 4.5%, Eritrea with 5%, Madagascar and Uganda each with 5.3%, Burundi with 5.4%, Niger with 5.5%, Burkina Faso with 5.6%, Malawi and Rwanda each with 5.8%, and Chad with 6.1%. These obesity figures contribute to the explanations as to why the COVID-19 pandemic is more prevalent in the European and Northern American countries discussed above, and also why the pandemic is more prevalent in Northern African countries and South Africa, because they tend to have relatively higher rates than most sub-Saharan African nations. For example, our second video shows that all 10 countries in Africa with the highest obesity percentages are in Northern Africa and Southern Africa. Number 4, low rates of urbanization in African nations. What has been regularly considered a liability for Africans in Africa might now turn to be a strength in the continent's attempt to avoid the worst effect of the spread of COVID-19. Slow urbanization in Africa. High rates of urbanization for a country is seen as a good indicator of modernization and economic development. This has now turned out to be a big liability for the countries impacted the most by coronavirus. Their relatively high rates of urbanization have resulted in the rapid spread of the coronavirus, partly because these countries have many large cities where residents use public transportation such as buses, rails, trains, in underground subways, and massive high-rise public and private housing buildings with hundreds and thousands of residents. For example, the urbanization rate in the United States as of 2020 is 82.7%, United Kingdom 83.9%, Canada 81.6%, France 81%, China 61.4%, Italy 71%, Spain 80.8%, Germany 77.5%, Russia 74.8%, Saudi Arabia 84.3%, Belgium 98.1%, the Netherlands 92.2%, and Switzerland 73.9%. African nations, on the other hand, have continued to experience slow urbanization, and some studies even tend to show declines in urbanization rates for some countries. At 11.635 million square miles, Africa is such a massive continent that its 1.34 billion people inhabiting it seem to be a small number for its size. As of 2020, the following African countries with at least 20 million people had the following urbanization rates: Algeria 73.7%, Morocco 63.5%, Egypt 42.8%, Sudan 35.3%, Nigeria 52%, Ethiopia 21.7%, Democratic Republic of Congo 45.6%, Tanzania 35.2%, South Africa 67.4%, Kenya 28%, Uganda 25%, Angola 66.8%, Mozambique 37.1%, Ghana 57.3%, Cameroon 57.6%, Côte d'Ivoire 51.7%, Madagascar 38.5%, Niger 16.6%, Malawi 17.4%, Burkina Faso 30.6%, and Mali 43.9%. These low urbanization rates in most African countries, in addition to the continent being very vast, has helped to slow the spread of the coronavirus. The countries impacted the most right now tend to also be highly urbanized, which results in very congested cities and towns. It is in such environments that the coronavirus tends to be very effective in spreading among people. Number 5. Hot temperatures and high humidity in most African countries. Scholars have pointed out that viruses, including those within the coronavirus family, tend to have less success infecting people in regions that have high temperatures and high humidity. Some of these scholars have used Africa, especially countries closer to the equator, as an example. The viruses, however, are more successful in spreading in cooler regions of the world. Most of the countries hardest hit by the current COVID-19 tend to have cold and long winters or temperate climates. Even in Italy and Spain, two southern European nations, the coronavirus is more prevalent in the northern and cooler regions of those countries. The evidence shows that the hot temperatures and high humidity in most countries in Africa could be contributing to slow down the spread of the coronavirus. South Africa and northern African nations have the highest infection rates of the coronavirus, and this could be due to the fact that they are farther away from the equator. South Africa, for example, has a winter season with snow when it is summer in North America. North African countries are reported to be cooler from September to January in the coastal regions. Number 6. Proactive policies and preparation by African governments and people. African nations were able to observe in real time the devastation of the coronavirus in China in January and February, and in Europe and the United States starting in March. As a result, the government and people of almost all African nations took proactive measures immediately to reduce the spread of the coronavirus. Some of the measures taken include closing all educational institutions, locking down entire regions of a country or the entire country, with almost all non-essential businesses closed. The borders of countries across the continent were also shut down, including ports of entry, especially airports, including international flights. Depending on the African country, some of the lockdown measures were for a few days at a time, or for a week at a time, or every 2 weeks, and then they would extend as needed. Even before the lockdowns and after partial reopenings of countries, there were water stations all across large and small cities and towns for people to wash their hands regularly, and almost all businesses had people stationed outside of their premises to give hand sanitizers to customers and guests. Social distancing measures were also mostly observed, whereby people stayed at least 6 feet from others. A very substantial number of leaders and the masses all across the continent were seen with face masks on. Without any doubt whatsoever, these measures substantially reduced the rapid spread of COVID-19, albeit at a great financial cost to the continent after working hard in the past decade to substantially improve the economic status of people on the continent. Number 7. People spend more time outdoors in African countries versus Europe and Northern America. Unlike in European and Northern American countries, Africans spend a lot of time outdoors where the coronavirus is less effective. In Europe and the United States, on the other hand, in the winter or summer, people spend a lot of time indoors at restaurants, bars, clubs, movie theaters, and other indoor entertainment venues. These are the spaces where the coronavirus is very contagious. This video has presented 7 factors that have contributed to the low spread of COVID-19 and deaths in Africa relative to other regions of the world. These factors include a combination of natural phenomena and proactive measures by African governments and people in African countries.